This is the anterior view of the upper limb. On the left side of the screen, you have the pectineus. The origin is the pectinal line of the pubis and narrow area of superior pubic ramus below it. The insertion is a vertical line between the spinal line and gluteal crest between the lesser trochanter of femur. The action flexes adducts and medically rotates hip. Next is the adductor longus. The origin is the body of pubis inferior and medial to the pubic tubercle. The insertion is lower 2/3 of medial linea aspida, and the action adducts and medically rotates hip. Next is the gracilis. It is inferior to the adductor longus. The origin is the outer surface of the ischio-pubic ramus. The insertion is the upper medial shaft of tibia below the sartorius, and the action is adducts hip, flexes knee, and medically rotates flex knee. Inferior to the gracilis is the vastus medialis. The origin is the lower intertrochanteric line, spinal line, medial linea aspida, and medial intermuscular spectrum. The insertion is the medial quadriceps tendon to patella and directly into medial patella via ligamentum patellae into tubercle of tibia. Action is to extend the knee and the patella.
Next is the sartorius, which is on the right side of the screen. Its origin is immediately below anterior superior iliac spine. Its insertion point is the upper medial surface of the shaft of the tibia. Its action is to flex, abduct, and laterally rotate the thigh at the hip. It flexes and medically rotates the leg at the knee.
Next is the rectus femoris. The origin is a straight head, anterior-inferior iliac spine, reflected head, ilium above acetabulum. The insertion are the quadriceps tendon to patella, via ligamentum patellae into tubercle of tibia. Next is the vastus lateralis. The origin is the upper intertrochanteric line, base of greater trochanter, lateral linea aspida, lateral supracondylar ridge, and lateral intermuscular septum. The insertion is the lateral quadriceps tendon to patella via ligamentum patellae into tubercle of tibia. The action is to extend the knee. This is a posterior view of the upper limb. First is the bicep femoris on the left-hand side. Its origin is a long head, upper inner quadrant of posterior surface of ischial tuberosity. The short head, which is the middle third of linea aspera, lateral supracondylar ridge of femur. The insertion point is studios process of the head of fibula, lateral collateral ligament, and lateral tibial condyle. The action is that it flexes and laterally rotates the knee. Long head extends hip. Next is the gluteus maximus. Its origin is the outer surface of ilium behind posterior gluteal line and posterior third of iliac, crest lumbar fascia, lateral massa sacrum, sacrotuberosus ligament, and coccyx. Its insertion is deepest quarter into gluteal tuberosity of femur, remaining 3/4 into iliotibial tract. Is the extension and lateral rotation of the hip. Inferior to that is the adductor magnus. Its origin is the ischiopubic ramus, hamstring portion, lower outer quadrant of posterior surface of ischial tuberosity, and the insertion point is the adductor portion, lower gluteal line and linea aspera, the hamstring portion, adductor tubercle. The function is that it adducts and medically rotates it. Inferior to that is the semitendinosus. It is also medial. Its origin is upper inner quadrant of posterior surface and ischial tuberosity, and the insertion point is the upper medial shaft of tibia below gracilis. Its function is that it flexes and immediately rotates the knee, extends hip. Next is the semimembranosus on the right-hand side of the screen. Its origin is the upper outer quadrant of posterior surface of ischial tuberosity, and the insertion point is the medial condyle of tibia below articulate margin, fascia over popliteals and oblique popliteal relief. Function is that it flexes and immediately rotates the knee, extends hip.
Next is the gluteus medius, which is superior to the gluteus maximus.
Its origin is the outer surface of the ilium between posterior and medial gluteal lines, and its point of insertion is the posterior lateral surface of greater trochanter puni. It abducts and medically rotates hip, tilts pelvis on one.
The anterior view of the lower limb. We'll start with the gastrocnemius on the left-hand side of the screen.
The origin is the lateral head and the medial head, and the insertion is a tendocalcaneus to middle of 3 facets on posterior aspect of calcaneus.
Inferior to that is the soleus. Its origin is the soleal line and middle third of posterior border of tibia and upper quarter of posterior shaft of fibula, including the neck. Its insertion point is the tendocalcaneus to middle of 3 facets on posterior surface of calcaneus. The action is that the plantar flexes the foot. On the right hand of the screen, you will see the tibialis anterior. Its origin is the upper half of the lateral shaft of tibia and intraosseous membrane. Its insertion point is the ephreno-medial aspect of medial cuneiform and base of first metatarsal. Action is to extend and invert the foot at the ankle. It holds up the medial ligament longitude arch of the foot.
Proximal of lateral side of fibula. The insertion crosses plantar surface of foot to attach to lateral sides of medial cuneiform and first metatarsal.
The action of the fibularis brevis is the plantar flexes and everts the foot at the ankle. On the lateral view of the lower limb, we'll start with the fibularis brevis, which is inferior to the fibularis longus.
The origin is the lateral side of the fibula. The insertion is a tuberosity on lateral side of the 5th metatarsal.
The action of the fibularis brevis is the plantar flexes and everts the foot at the ankle.
It's an anatomy kit.
Gomez, and I approve this message.